Fusidic acid. Fusidic acid was discovered in Copenhagen, Denmark, and introduced to clinical practice in the 1960s. It was derived from a fungus called Fusidium coccineum. Fusidic acid has a structural similarity with the steroid molecule. You can see in the picture the molecular structure is similar to prednisolone. For this reason, it is called a steroid antibiotic. It also has a structural similarity with cephalosporin P. However, the cephalosporin antibiotics we use are derived from cephalosporin C. Hence, fusidic acid is not a cephalosporin. Mechanism of action. Fusidic acid inhibits protein synthesis by targeting elongation factor G. Due to its binding to the EFG, it prevents the translocation of tRNA carrying the amino acid on the ribosomal mRNA complex, hence amino acid fails to be incorporated in the growing peptide chain. In the next few slides, I will try to show this with the help of a diagram. The mRNA, which acts as the template for protein synthesis, forms an mRNA ribosomal complex. The other type of RNA, called tRNA, carry amino acids to this complex. Amino acids are combined to form protein or peptides. There are 3 sites in this mRNA ribosomal complex connecting to the tRNA. These sites are called A, P, and E sites. The tRNA, carrying an amino acid, attaches to the A site. In our slide, this one is with a green dot. The P site at this time hosts the tRNA, which is attached just before the green tRNA. This tRNA, marked by the orange dot in this slide, also carries the peptide or protein chain which already started forming. The amino acid on the green tRNA should form a bond with the peptide chain on the orange tRNA, so the peptide chain can get longer to carry on protein synthesis. Elongation factor G or EFG is essential for protein synthesis once this bond has been formed. EFG facilitates the tRNA movement from the A site to the P site. This is important as the following tRNA, in this case, the one with a yellow dot, can occupy the A site to provide the next amino acid to the peptide chain. So if we can prevent the elongation factor G, the green tRNA will not be able to move to allow for the next tRNA amino acid. Protein synthesis will stop. This is what fusidic acid does. Mechanism of resistance. Bacteria can develop resistance to this antibiotic by 3 mechanisms. 1. Reducing the target affinity, that is, an affinity for the elongation factor G. 2. Enzymatic destruction of the antibiotic, and 3. The efflux pump helps the bacteria remove antibiotics from its cell. The most important resistance mechanism is a mutation in the Fus gene, which produces elongation factors with low affinity. There are various types of mutation, Fus A to Fus E. All of these are seen in Staph aureus. Fus B mutation has been associated with an epidemic impetigo strain. Other types of mechanisms like enzymatic destruction of ACR-AB efflux pump can be seen in some gram-negative bacteria. Fusidic acid has a variable bioavailability when used orally. Suspension and some older preparations have a bioavailability of 50 to 70%, while the newer film-coated preparation may have bioavailability equivalent to an 4 preparation. It is highly protein-bound, more than 95%. It has been seen that when using it systemically, a loading dose may help to achieve a steady state quicker. It has wide distribution in the body, however, does not penetrate the uninflamed meninges. It is able to penetrate abscesses and retain activity in a low pH environment. It is metabolized in the liver and the main route of excretion is bile. Adverse effects. The common adverse effects are seen at the site of drug administration. For example, gastrointestinal symptoms can be seen with oral administration. Thrombophlebitis can be seen in cases of IV administration. Topical use in eye infections can be associated with local irritations. Other adverse effects are 1. gastrohepatic, hyperbilirubinemia and decreased appetite. 2. CNS symptoms like dizziness and headache. 3. Hematological adverse effects, anemia, leukopenia, and thrombocytopenia. 4. Skin rash, toxic epidermal necrolysis, Stevens-Johnson syndrome, and DRESS syndrome. 5. Rhabdomyolysis, which has been associated with concurrent use of statins. Fusidic acid is considered a narrow-spectrum antibiotic, as its activity is mostly limited to gram-positive bacteria. In clinical practice, it is mainly used for Staphylococcus infection. It has activity against Staphylococcus aureus including MRSA. Some coagulase-negative Staphylococcus are also susceptible. Streptococcus are less susceptible, and Enterococcus are often resistant. Fusidic acid has activity against Corynebacterium and some mycobacteria. Gram-negative bacteria are resistant except only a few, for example, Neisseria, Moraxella, Legionella. It has an excellent anti-anaerobe spectrum and is active against C. difficile. However, Fusobacterium and some Bacteroides tend to have high MIC indications. Fusidic acid is primarily used for Staphylococcus infection. Topical preparations can be used for skin and eye infections. Oral and IV preparations are mainly used for severe and deep Staph aureus infections. However, when used systemically, fusidic acid should be used in combination with another antibiotic to prevent the development of resistance. Resistance may develop quickly even during the treatment when used on its own.